To one and all. Yes, sir. Very warm good evening to one and all. Here we begin the technical session 2 of the first day international webinar on women and development. First of all, I would like to welcome the chairperson, Dr. Bushra Begum RK, Assistant Professor, Department of Sociology, University of Kerala. She did her PhD in Sociology from the Department of She is a member of International Sociological Association, lifelong member of Indian Sociological Society and Kerala Sociological Society. Her areas of research are sociology of development, development-induced displacement, resettlement and rehabilitation, gender issues, people and culture of developed, developing and underdeveloped countries. She has made several publications in journals. Welcome you, ma'am, to chair the session.
Thank you.
Next,
Thank you.
Next, I would like to welcome Dr. Bindu Varghese, who is the Assistant Director, General Education, Higher Education, Technical Education, and Gender Development. She has completed her PhD from John Mathai Center, has worked with Kudumbashree, and she has worked a lot on Kudumbashree, and she has also done projects with UNDP and CDS. Welcome you, ma'am.
Thank you. Thank you.
I welcome all the teachers, non-teachers, and students to the technical session 2 of the international webinar. I also welcome Siddharth R., First Sem Economics, University of Kerala, who is here to deliver the vote of thanks. Now, I welcome Dr. Bushra Begum to chair the session. Ma'am, please.
Okay, thank you. Good evening, all. Good evening. Today's guest, Bindu Varghese, Kerala State Planning Board member, then all teachers and dear students and other teachers in the department. Let me formally welcome Dr. Bindu Varghese, member Kerala State Planning Board. Today's topic is actually, first of all, I appreciate Siddiq Rabi to taking initiative for conducting such a wonderful seminar and selecting a topic like this, women and development. I think he has been conducting this kind of seminar in each and every year. He is conducting this kind of seminar. So I appreciate and sincerely support the initiatives of Siddiq Rabi. Then today our theme is women and development, and our guest is going to talk on the topic women as leaders of response and resilience Kerala during COVID-19. I know that you might be very tired after attending all these sessions in this period. That's why I'm not taking much of your time. First of all, let us give time for the speaker Bindu Varghese to give her lecture. After that, we will conduct our discussion. Thank you. So let me formally welcome ma'am.
Thank you, Bushra. Okay, am I audible?
Yeah. Audible.
Very good evening to all, and I'm really happy to be here with you, with the young people, that's the students. For the last 4 or 5 years, I have not been with students, and hence I'm really happy to be here with you. I know that all of you are very tired because of the heavy loaded sessions in the morning and in the afternoon. But today, really I'm thankful to Siddiq for inviting me and giving me this opportunity. As you know that, as all of us know that all disasters, whether it is pandemic or a natural calamity, will have some impact on all human beings. That's why we are here in a virtual meeting instead of a direct or vibrant interaction. But the impact may vary according to the caste, class, region, ethnic group, and gender, etc. Can I share the PowerPoint here now? I think so.
Yeah, sure.
Is it visible, Siddiq?
Yeah. Visible.
Okay. Um, yeah, as we know that all disasters affect human beings in general, but the impact may vary according to the caste, class, region, ethnic group, or climatic conditions. But all these disasters will have some particular impact on women. This impact actually doubles in the case of a women who are in the case of women who are in the lower caste or lower class or lower socio-economic category. Already, even in the normal situation, women in this category are subjected to double forms of exclusion. On the one hand, they have to suffer from the um, consequences of belonging to a lower strata or lower caste or lower class backgrounds. And on the other hand, being a woman, they have to suffer the gender oppression that generally prevail in society. Now, when the pandemic occurs, the situation becomes worsened in the case of any disaster, especially in the pandemic. Of course, we can always ask the question whether the pandemic is the disaster or is it the lockdown which causes disastrous impact. Why we ask this question? Because a lockdown of this level demands the state to effectively address the livelihood requirements of all the segments of population, especially those in vulnerable sections. Of course, this will directly lead to the questions to what extent the governments have effectively uh, handled the situation. We know that Kerala have, to a certain extent, handled the situation more effectively compared to the other states and at or national level. And in my presentation, what I'm saying is that how women at the grassroots level performed a central role in helping or supporting the state government to handle this situation. So the presentation will focus how these women who are otherwise considered as subjects in the normal political, socio-economic frameworks have played an agential role during this period of crisis. Why this deserves special mention or special attention? Because we don't usually find women at these grassroots level backgrounds capable of playing such a role. Rather, they are usually looked upon as people in the receiving end at two levels, receiving states' welfare policies and also at the receiving end of the already existing patriarchal oppressions in the society. However, in this context of pandemic-induced lockdown, we see a drastically different scenario. As I said, many of these women assumed a leadership role in the whole welfare mechanism. In this small presentation, I would like to present women as leaders rather than mere beneficiaries of any development programs or affected persons of pandemic. And we know that this leadership role is not an impact of a overnight scenario. It's definitely the result of decades-long empowerment programs and also some other related historical factors. But anyway, I'm not going to the historical roots now because of the time constraints. And before I go to the Kerala states and Kerala's experience, let me go to the a glance on the international scenario. Of course, we know that at the international, yeah, at the international level, we can see that a pandemic has also been an occasion for revisiting the gender conceptions and stereotypes of leadership. It is already in the limelight that as how countries like New Zealand, Taiwan, Germany, with women leaders have done much better in countering COVID-19 than others. They have set example for other countries to follow. A lot of studies have been there to say that the women-led countries could handle coronavirus better than the men-led countries or their men counterparts. The situation in the above mentioned women-led countries have been compared with that of other male-led countries with the same socio-economic and development profiles. Many studies have done that, and the outcomes of unbiased inclusive and early measures and initiatives of these women leaders seem to be systematically and significantly better. And we have had a lot of the names like Germany's Angela Merkel, New Zealand's Jacinda Ardern, Denmark's Mette Frederiksen, Bangladesh's Sheikh Hasina, all have better handled the situation compared to the male counterparts. Many studies have shown that. And when we come to Kerala also, we know that the health minister Srimati K.K. Shailaja teacher took an active role in crafting the defense against the pandemic in all phases of its spread. Her efforts have been globally appreciated. Earlier also, when there was a health emergency because of Nipah virus outbreak, she could handle the situation very efficiently. And if it was not for the sturdy and early state response to the epidemic under her leadership, Nipah could have grown to an alarming proportions given its records in different parts of the world, including Bangladesh and Singapore. Now also, health department is under her able leadership has been effectively handled the COVID-19 pandemic from the time it has affected Kerala. But my presentation, I'm not stopping here. Actually, I'm coming to the real grassroots level leaders of Kerala who actually help the government and help the leader, the topmost leadership to handle the situation very effectively. Here I have taken three sections of women workers, that is women leaders. I'd like to call them as grassroots level leaders or women leaders in the grassroots level. Three sections I have taken, Kudumbashree workers, Anganwadi workers and Asha workers. And in this slide, I just show the volume of their membership and their the membership and their number of workers. And we know that at Kudumbashree level, there are it's a three-tier system. And at the Panchayat level, there is an Panchayat level apex authority that is called as CDS. And at the ward level, there is an elected system that is called ADS. And at the grassroots level, that NAG, that is neighborhood group. ADS means Area Development Society, that's the ward level members, and CDS, that is Community Development Society, that is the apex body of this community organizations. And the main, when in March 2019, 2019, when this coronavirus outbreak was reported from China, Government of Kerala has taken effective steps, to be cautious about this coronavirus, and the government know that it's the better thing is to make community awareness and to link between community and the health sector. So this Kudumbashree workers, the government sought the help of Kudumbashree workers, Anganwadi workers, and Asha workers from the beginning itself. When the first outbreak of coronavirus happened, itself this government sought the help of these Kudumbashree workers, Anganwadi workers, and Asha workers. Altogether, 66,000 Anganwadi workers are in the field, and the total membership of Kudumbashree is 45 lakh. That is the 60% of the total households in Kerala, and it's stated that nearly 90% of the poor families are covering under this 45 lakh NHG families, NHG members, and more than or nearly 30,000 active ASHA workers are also in the field to handle the situation. This is the volume of the membership, the number of members. And I would like to categorize the role of these women leaders into four. That is, first one is awareness campaign, and the second thing is the link between community and that health networks, and the third, care and safety. And the fourth one is livelihood and economic activities. And And when we come to the awareness campaign, that was very important because this coronavirus situation, this pandemic situation is completely not familiar to Kerala, not only to the Kerala, but all world. So awareness was very important. So when even before the government officially declared the lockdown, NHG special meetings were held out to discuss this topic on March 21st and 22nd. And the aim of this campaign was to inform families through NHGs regarding the care and vigilance needed to prevent the spread of this pandemic. Through the special meetings, the families were informed of the importance of social distancing and personal hygiene to prevent the disease. And Kudumbasri and Anganwadi workers and Asha workers actively engaged in awareness campaigns. The first one is the government declared Break the Chain campaign. Actually, that campaign became success only because of this women's participation. And many parts of the state, Anganwadi workers have done the hand washing demonstrations, and through the energy meetings, they did the mouth to mouth campaign, and even Kudumbasri did a special campaign known as social distance, that is social distancing campaign known as Kudagalilude Samuhya Agalam. That is social distancing through umbrellas. So I think I can show some pictures here. This was a picture from Thrissur district. Orumekke oru kuda agam, umbrellas for unity. And also, they have done a lot of motivation. Yeah, when the lockdown started, we know that children and especially elderly and children were very much affected by the mental stress, and a lot of stress and mental problems were there, and it was reported all over the state and all over the world. And Kudumbasri, with this aim, Kudumbasri started some motivational campaigns. And the campaigns, when as the social distancing and break the chain campaign announced, Kudumbasri entered into a new things, that is the social media networks they use for those things. Kudumbasri created WhatsApp groups at all levels in the three-tier organization networks, and at present there are nearly 2 lakh groups with 22.5 lakh members. So that is a new thing for Kudumbasri members, that instead of a face-to-face energy level personal interaction, they have started to spread the messages through the WhatsApp groups. And for this purpose only, they created nearly 2 lakh WhatsApp groups with 22 for nearly 23 lakh women members. And they are sending some posters and other positive communication to all through this WhatsApp groups. I would like to share one or two this type of posters, break the chain campaign. ഉമ്മാന്റെ ക്ഷേമത്തിനായി നമുക്ക് പനിയും ചുമയുമുള്ളവരോട് അടുത്ത് ഇടപഴകാതിരിക്കാം. Like very beautiful and catching posters they circulated among the energy members. And this is also part of break the chain campaign, hand washing thing, and avoiding social gatherings. A lot of things they have circulated through this by circulating these posters. And I'm also sharing some of the motivational campaign posters for addressed to children, and also for elderly, and for agriculture things, for engaging for productive activities. A lot of motivational campaign things that have circulated. And in the first set of posters, focusing on general precautions, care for elderly persons, and the second set of posters, what all to do during lockdown, that is positive message that's given in the motivational campaign. And as I said, in the second most important thing is the COVID prevention activities. That's the link between community and health networks. And when the notification regarding the outbreak of the novel strain of coronavirus in Wuhan city of China was received, the Kerala government activated its alert mechanism and emergency response mechanism to prevent an outbreak within the state. At this time itself, government of Kerala understood that the best solution to point out is to community awareness and community mobilization as strategies to contain COVID-19. And they understood that the government and all leaders understood that there is these community members are the most important influential link between the community and the healthcare system. So as a part of that, government of Kerala formed a rapid response team at ward level, and it's a five member committee, and JPHN will be the convener, ward member will be the then Asha worker, Anganwadi worker, and Kudumbashree member. Apart from that, some political leaders or retired persons or residents association leaders can also be members of this group. But this rapid response team is called as Golden Five by the Malappuram district collector Adila Abdullah, by seeing the effective works done by the rapid response team at the ward level. They called, it's in the initial stage, Wayanad district was, for sometimes was a coronavirus free districts. At that time, collector called this team as rapid response team. And this team follow up the persons in quarantine daily and assess the symptom status and other medical needs and non-medical needs. The ASHA workers also follow up persons in quarantine on daily basis, and they assess the symptomatic status. If a person is quarantined, becomes symptomatic, ASHA informs the PSC or CSC, who mobilizes the person in quarantine for swab testing for corona, and sometimes they may be admitted in the hospital, or sometimes they may be observed in the home itself. And the second thing is that these three sections supply liters and liters of sanitizers to the district headquarters as well as to the general public also. Sometimes it may be based on the cost, on some prices, and sometimes free. And another thing is the Sannadha Sena thing. Sannadha Sena, it was created by, that group was created by the government of Kerala. And when it can be registered, we can register voluntarily to the Sannadha Sena. But when the Sannadha Sena was announced, at the initial stage itself, more than 60,000 Kudumbashree workers joined the Sannadha Sena members to work for this effective campaign and COVID prevention activities for voluntarily. And I think this is the most important thing that these women have played, because they acted as a link between community and the health network. That was very important for a government to prevent or the coronavirus, the spread of the coronavirus. The next thing is that is care and safety thing. And we know that community kitchens started by Kudumbashree and local bodies were very famous. Even World Bank and UNDP have appreciated the community kitchens which were worked during the time of lockdown. As a policy initiative, government of Kerala announced that the state would be hunger-free state, or there won't be any person without food. So after a fortnight's operations, community kitchens in Kerala are work cooking and distributing on an average 2.5 to 2.8 lakh of food packets a day. That means the nearly 3 lakh food packets were dished out from this community kitchen by these women. And of course, sometimes there may be, as I said, in the case of sanitizer, they were not completely free, but for those who are in need, they were free, and otherwise they have charged a nominal amount for this food packets. And across more than nearly 1,300 community kitchens in 4 districts, the volunteers were very cautious about maintaining social distancing, Of the total, nearly 200 kitchens were function under the municipal corporation. And the third thing is that Government of Kerala announced the food kits to all. And for that also, this efforts of women are there. Civil Supplies Department of Government of Kerala has asked the help of Kudumbashree volunteers to prepare grocery kits for 87 lakh families. So nearly 87 lakhs families are there as per the ration cards. The same has been undertaken by the Kudumbashree, and nearly 600 volunteers were engaged in this activity, and they are working for this activity from the 9th April onwards. The packing of grocery kits is being done in nearly 60 warehouses across the state. Then the THR delivery by Anganwadi. THR means the take home ration scheme, that is the food packets which can be issued for children under below 3 years and pregnant and lactating mothers. Actually, when the normal days, these THR things are delivered at the Anganwadi centers. But when the lockdown happened, Anganwadi workers delivered the CHR the doorsteps of all beneficiaries. Then these Anganwadi workers conducted an elderly survey and that's around 45 lakh elderly via phone, and data was shared with various government departments for follow-ups and intervention. And then the psychosocial support. More than 1,000 social support psychosocial workers are there with the WCD Women and Child Department, that is the Anganwadi workers. But these psychosocial workers were assigned with health department to support the health department. And another thing is Snehida. Snehida and gender GSLP. The two programs are the Kudumbashree's gender awareness program. Snehida is the system in which we can support the affected women, that is harassed, if they are women who are mentally or physically harassed by anybody. They can seek the help of Snehida through phone call, on they will assist the women. That is a normal thing, but in this case of lockdown also, Snehida helped us, became very active and helped the women very much. And through Snehida and as well as GSLP programs, a lot of online games for energy women, then grocery distribution, tribal areas, and vegetable distribution to elderly community. A lot of things have happened. And again, Asraya project, that's the project which is implemented by the government of Kerala for the destitute families. That is the poorest among the poor. And nearly 1.5 Asraya destitute families are supported through this, this with the help of resource persons of Kudumbashree, and the food kits and all types of help were delivered at their doorsteps by Kudumbashree resource persons. And the fourth thing which I would like to say that is the most important, I can say that every role played by them are very important. That is the livelihood and economic activity. The government, we know that at the time of lockdown, the economy was completely stuck, and all the shops and every economic activities were closed. And even a minute activity done by these women were very, very important to induce the economy and also the induce the livelihood activities of the poor women. Kudumbashree prepared. We know that Chief Minister Sahaya Hastam, that's a helping hand program of Chief Minister. That's 2,000 crore rupees were distributed to the poorer people through NAG members, through Kudumbashree. That is at least up to 20,000 can be taken as loan from Kudumbashree NAG. That is the scheme of Sahaya Hastam scheme. All these 2,000 crore rupees were distributed through this Kudumbashree energy. And it was very important that at the time of lockdown, this Sahaya Hastam Paddhati was really to help and to increase the bargaining power or the purchasing power of the poor people, and that will automatically induce the economic activities all over the states. And when I talked about sanitizers and mask preparation, it's very important that some of the sanitizer and mask distribution was voluntarily and freely, but they could earn a little amount from the sanitizer and mask preparation. Kudumbasri has prepared and sold more than 72 lakh cotton masks through around 306 tailoring units. Also, 21 micro enterprises units have prepared nearly 1,000 liters of sanitizers as on this in the last week of September 2020. So when this nearly 75 lakh cotton masks means they were earning more than 10 crores of rupees uh, till this September. So that was a big, even though it seems to be very small amount, that was very important during the time of this complete lockdown. And during the COVID-19 pandemic, Kudumbasri has started to make face shields a protective gear that can be used by medical staff engaged in treatment of COVID-19 patients. They could sell nearly 96,000 face shields by the end of the set. That number has again been increased. I could not collect the latest figure. And the community kitchen, though it was a care thing, I quoted this community kitchens in the previous slide. Here also I'm repeating the thing because the community kitchens have had two roles, double roles in the time of lockdown. The first thing is that it was a clearance of safety networks to the poor sections who are not able to to have food. On the other hand, community kitchens were a source of income to the Kudumbasri women. So in Kerala, nearly 1,500 community kitchens were there, and they have started in all panchayats and municipality with the help of local government institutes. And out of this, some of the community kitchens were already the budget hotels started by the Kudumbasri. That is, budget hotel means food can be taken at rupees 20 per meal or 25 per meal to all. That's affordable rate. We can have food from this community kitchens or budget hotels. After these community kitchens, the number of budget hotels are on the rise. That is the positive thing happened. And we know that Supplyco has asked Kudumbasri to supply food cloth, means not food cloth, cloth bags to distribute this grocery kits. So Kudumbasri has started the production of cloth bags for the same, and nearly 25 lakh cloth bags was 25, not 25 lakh, 20 crore, 2 crore cloth bags were prepared and supplied to Supplyco by Kudumbasri. And after that, apart from these community kitchens, they have started some this takeaway counters in these areas. That is, a few hotels near the check post in Kerala. There were very few hotels, and the drivers and near the NH are face hurdles in getting enough food. And transportation department has asked Kudumbasri to establish some takeaway counters. That was also a very good income support to the Kudumbasri members. And the third one is, yeah, I told you that social distancing through umbrella, but umbrella making was not only a social distancing method, it was an income generation to Kudumbasri members, because through this, when the lockdown started and the school was closed, the umbrella making units were really in trouble, and Kudumbasri started this campaign of social distancing, and the umbrella making units could earn a little bit because of this umbrella sold, and they could sold more than 50,000 umbrellas for this campaign, and they could earn a very good income also from that umbrella selling. And they have started some floating supermarkets in some parts, especially in Alappuzha. They started some floating supermarket. This is a picture of a picture of floating supermarket in one panchayat in Alappuzha district. And like this, a small income generation activity they found, and they started in many parts, but it's not in a large scale, but very small scale things. But actually we could not identify this as a very to induce the income generation activity or to induce the economic activities of the state. In that way, Kudumbashree members, ASHA workers and Anganwadi, ASHA workers' role was mainly between the health related things. They mainly acted as the link between health department and community members regarding the health awareness things, and then for follow up the quarantine things, they actively engaged. But after, beyond that, Anganwadi workers acted as more on this care and the safety measures. They more actively engaged. In the case of Kudumbashree, they were in all fields. That's the case of awareness campaigns, and in the case of link between community and health networks, and the third of this livelihood and economic activity. In all the activities, Kudumbashree workers were very active, and even now they are very active. So this is a small presentation, and I'm stopping here because it's better to ask, I think, some questions, because yeah, I am, before I concluding my small presentation, I may say that actually I would, in this small presentation, I actually wanted to show that that is, we have to give tribute to this grassroots level leaders, women leaders at this moment, because even though we have gathered some information that the Kudumbashree members and women leaders done a lot of things, we have some of the information we have gathered through newspapers. But through this presentation, I just wanted to consolidate the things, and how they played an important role during this uh, distress situation of the state. And with this, let me stop. And because I am not going to much details, because the time is already too late, and it's better to have some small discussions also when if there are any questions or queries or comments. Thank you very much.
Thank you, Dr. Bindu Varghese, for having a wonderful discussion on women leaders on COVID-19 pandemic. Actually, even though the time is late, it was a very fruitful discussion. I think all of the students have to listen this kind of topics, because every time women are considered as a beneficiary of welfare policies and other kind of services of the government or other non-governmental organizations. But ma'am has really has said that actually women are working, women's agency is working at present, even in the time of a pandemic. They have shown us very wonderful activities that they could done in this period. And ma'am has pointed out about the real grassroots level, how Kudumbashree workers, Anganwadi workers, and ASHA workers, how they performed well in the COVID-19 period, and their participation helped the social distancing campaign. Then actually these are all the lessons that we have to think about it. So let me ask you, let me tell you whether if you have some doubts and clarification, you can please ask. Otherwise, you can send us messages so that I can read out. Then ma'am will answer you. Students, participants, if you have any queries, you please ask.
Ma'am,
Okay.
I want to ask if you have considered the women working in the private sector tailoring units while during the COVID time, they contributed a major share of the mass and other things for the COVID health workers. Did you consider their contribution?
Yeah, of course. I recognize them also, but the thing is that I don't have exact data regarding their contribution or their quantum of work that they did for health thing. Actually, through this presentation, I really want to give focus on the grassroots level women. For example, I took the case of Kudumasi workers and Anganwadi workers and Asha workers, because when we talk about the private sector shop tailoring units, we don't have exact data. They are the most unorganized sector workers in the field, and they are the most affected thing also, but they have contributed a lot. But the thing is that we don't have the data, so I didn't just mention, but their work is very appreciable. I know that. Just like Kudumasi workers, they have also contributed to contain the COVID-19 pandemic spread. I agree with you. Even though we are considering these as small works, these small works were the important things during COVID-19.
Okay, ma'am. Thank you.
Okay, next question. Next question. You can also send message. You please send questions as messages.
I know that during COVID-19 situations, women have had experienced a lot of bad experiences in the domestic violence, and a lot of things they have experienced. Those things have already been highlighted by media and all. But here I just wanted to show some positive pictures where the women could do during the time of COVID-19. That's why I just took the small topic for this presenting.
Actually, it is a relevant topic, ma'am, because all the time women are portrayed as just household workers and other kind of things. But women are not at all depicted as leaders. So that we have to present women
Again,
as
the thing
leaders.
that
How?
when we appreciate women leaders, we will confine our discussion to the ministers or the top level district
Yeah.
collectors will be the lead, will be in the limelight. But we will always forget the real grassroots level leaders. That's why I thought we have to give them a salute, at least during this Women's Day. I think Siddiq has arranged these things in relation to Women's Day thing, right, Siddiq?
It actually it was Women's Day. Tomorrow is the Women's Day. In the Indian Women's Day, earlier it was actually celebrated. Now, because of the International Women's Day, everything is pushed to March 8. So
Yeah,
otherwise,
yeah.
Sarojini Naidu's birthday. That is
Yeah,
tomorrow.
yeah, you talked me like that
Yeah,
when we
yeah.
called me
So
first
that
time.
was earlier celebrated as the Women's Day in India.
Ma'am,
I tell
you have
very
mentioned
more
that.
about.
Yeah, question is
Okay,
there?
ma'am, you have mentioned that one statement.
Pardon?
Ma'am, can I continue?
Yeah, sure, sure.
Ma'am, you have mentioned whether pandemic or lockdown as a real disaster. How do you perceive whether pandemic or lockdown? Do you feel any kind of restraints or constraints for
Yeah,
these women leaders,
yeah,
those who were working as the
yeah, both are disasters. But the thing is that when if the governments are not able to contain or to address the demands of the people properly, then the lockdown will be more disastrous. That is the situation. That's why I put that question. Only if
Okay.
yeah, Kerala, I think Kerala was an exception in that case. Otherwise you could witness a lot of scenes, the migrant workers, pathetic situations. A lot of persons were died out of hunger. A lot of things were happened. That's why I put that question, whether pandemic or it's the subsequent lockdown was the real disaster.
Okay. Okay. While they were, while these Kudumbasri workers, Anganwadi workers, and Asha workers, they were engaged as leaders. How did they manage their household affairs?
Yeah, when we just like working women, they are managing. I think, yeah, the last part of the presentation I heard something that is uh, but I could not sit fully. That is the time management. They are engaging more time on domestic works, and even in working women, they are doing like that. But I have some experience with Kudumbasri that when they, yeah, in the general, in the middle class family, the gender relations are all over Kerala. The gender relations are became have become changed very slowly. But in the case of Kudumbasri also this happens. So some kind of sharing in the domestic works and some kind of sharing in the social works they are doing. And just like working women, they are managing the household things, and also they get some help from their brothers and husbands, and sometimes they have to do the full work within the family and outside the family. That's the thing. They are handling the household things as well as they are handling the uh, but I have I have the feeling that they are more empowered than the general working women in the Kerala. I have because they are more free. I think they are more empowered, and they are, even though they are from lower economic strata, I think they have more courageous than the normal working women or normal middle class or women in Kerala. I have that feeling, and I think just like that they could anyway. It is a burden to them because of the lack of sharing, but still I observe that men have started to share the household works in Kudumbasri families. I think so. Yeah, this I am saying because when I visited one Kudumbasri chairperson, her husband prepared tea and gave to me. Can we expect that from a normal family, average family of working women in Kerala?
Correct. Correct.
That is not the normal thing, but that happens. That's what I'm saying. That the gender relations are becoming changed very
An
slowly.
excellent point. You could visit my house sometime.
Yeah, when you visit my house, you can see that, but that's those are exceptions.
Yeah.
Because my husband is a gender specialist and he does that, but that is
Yeah.
not
That's right.
it's a normal thing. That's the thing. That's what I'm saying.
True. That is. So,
Okay. I
what
see
about
there are a
questions?
number of
Yeah,
women
the channel.
participating.
Yeah, that yeah, I have an advice to economic students, though they have not asked anything. That is how Kudumbasri and especially Kudumbasri, because they are the big number compared to Anganwadi workers and Asha workers, and how they could induce economic activities, and they could increase the purchasing power of the society. That's to be analyzed very seriously. Even that Chief Minister's Sahaya Sampadadi itself was just implemented through the Kudumbasri NHG. That was very important in the case at the time of that pandemic. That's how this social inclusion and that is access to financial inclusion and this purchasing power and the Keynesian multiplier, all those economic terms can be applied when you study the Kudumbasri things. That's my advice to the to my young friends in your department. I have not tried to analyze
I
the
see there are
professional.
number of
Thank you. Yeah. Is there any question from the side of the students? And then please chair, please, invite.
students. Students, please ask. There are number of women participants are there. You
Yeah,
please ask.
the Department of Economics is actually having more women composition than men in faculty, in students.
That is not only in economics department, is it? All over the higher education
Yeah.
sector.
I know, but still, for us, it is.
I really wonder why, where do these boys go? I really wonder. When I
And
see
now
the
that is what couple of months back we had a discussion that we need to really look into the other composition, the changing composition, where this missing men,
yeah.
missing women earlier. Now you have
Instead
to
of asking missing women, we have to think of missing boys
missing boys and
from the higher education scenes. It's
yeah.
near. Yeah, I had a thought in my mind that the missing boys are really going to the technical education or professional education.
So even in the technical and professional
That
education,
thought is also false, because when I see the
yeah, composition, it is completely.
composition in the professional education, in the case of health sector, nearly 60% are girls. Only in the case of this engineering education, this 45% are girls and the remaining 55 are boys. But still, we can't bridge the gap of this missing boys. Sometimes,
Yeah.
yeah, we have to make a study on that. Yeah, anyway, we are debating our discussion.
Thank you anyway. If the students have no queries, then we can wind up the session, I think. Right? They are the real beneficiaries. They need to ask, or at the odd hour, maybe 5 o'clock. There is a question. We do have a lot of girl students in every field.
There is a question.
Yeah, top class positions. I got that question, but a top class position, if you say about the bureaucracy, women are there, because in all the heads of the departments, most of them are women. But in the case of legislative assembly, you are right. And parliament king, you are right. The political leadership at the topmost, men are dominating the scene. But in the case of other top positions, you say about the district collectors, IAS officers, judges, a lot of women are there, but the women are really missing from the law making body, that is the legislative thing. But I think in the near future that will be solved when
I think everywhere the composition is keep changing very rapidly. For instance, in the universities, we earlier thought that in the leadership, women were not there. But now, if you take the Kerala University, I think majority of the deans are women, because dean is the most important position as academic councils are concerned.
Siddiq, when I go to the working group, all the heads of the departments are women.
Yeah.
So, this lawmaking body, that is in legislature as well as in parliament, the proportion of women are less. But still, I hope that also will be changed, because when 20 years ago, what was the proportion in our women proportion in the local bodies? But now, what is the situation? Yeah, in
No,
the
that's what you are made an excellent observation, because this is what is going to reflect in the near future, because now 51%, more than 51 has been reserved.
yeah.
51 people, 50 is reserved, but more than 50 is there.
Yeah, 50, nearly 55% are women. Even from
Yes.
general seats, women are contesting and winning.
Yeah, right.
And I know some of the women presidents who have contested from a general seat and won, and doing a lot of wonderful works without considering the male dominance or the already male dominance. So I really hope that the situation will change.
Yeah,
Can we?
that's it. Except,
But still, you are right.
I'm still.
Even after this 60 years, we didn't have a woman chief minister.
Yeah,
That's really unfortunate.
true. Anyway, but still we will be making in the near future.
Yeah, but during this pandemic, our health minister was the real hero intro, right?
Yeah.
Yeah. So that will happen in the near future. I hope so. Who's asked this question, Sri Lakshmi? And can Sri Lakshmi be one of them?
So I think we can wind up the session if.
Let us wind up the session, Siddiq.
Yeah, so we have a.
So thank you,
Siddiq,
ma'am.
have you any comment?
Okay.
Of course, I have this particular. No, this is a very important point which you raised, especially the importance of women in the local level. That is really you brought out, because I really want to make sure that at least the students should know that actually things are happening in that fashion. We only get a macro picture and a reflection of the the leaders, as we rightly said. Maybe most of the time, our works been hijacked by some people who are so called. But I think this particular point is the most important one as far as the entire structure the discussion is concerned. So I think I'm very thankful that you have brought out the issue and put out for the discussion, as well as at least for the notice of the students. So things are okay, and I'm happy.
Actually, when the lockdown is over and the colleges reopen, I think hope that
I am
we can
expecting a
have.
paper from you, because I have to get it.
Yeah, we can have. I think I am more comfortable with the direct interaction rather than this virtual meeting, so that we can interact with the students more freely and they can ask questions, and I
Yes,
can
yes.
share the field experiences with them, and policy level things I can share with them. So hope it will happen in the
Yeah, I
very
think
soon.
we are yeah, at least in a near within 6 months we can come and
Yeah,
interact.
Okay.
sure,
Even
Siddesh.
the COVID persists, we don't have an option now. So university is already opened from January 1st onwards. Though all the students are here, sometime you shut for a while and again you will reopen. So the point is that you cannot now run away from the reality. So this is a
Yes,
kind
yes.
of. So thank you. Here, chair, please
Thank you.
invite the
Thank you,
Thank you,
person.
ma'am.
Pushpa. Thank you.
Thank you. Actually, it was a very fruitful discussion, and it has provided an insight about women's work and contribution towards society. Earlier time, actually, people didn't calculated the women's effort, but at least actually at present, people are just acknowledging their efforts. That itself is a great reward
Yes, yes.
for them. So it's a very wonderful and a very relevant topic, and I appreciate once again. I appreciate Siddiq Rabiat for selecting this kind of seminars, selecting this kind of topic, and I appreciate Dr. Bindu Varghese for selecting and presenting this wonderful topic in a very lucid manner. That is why thank you so much. We will again invite you to present this kind of topic to our students. As Siddiq said, students never acknowledge. Actually, we always think about the women leaders. Actually, women leaders and women leaders are actually they are spreading all kinds of women who are working in the low kind of jobs and middle level of jobs. So we have to acknowledge their contributions towards society, towards the welfare of people. So it is a very big initiative. Thank you so much. I am also very. I take this opportunity um, as a actually it is a beginning for discussing this kind of topics. So in future also we will be discussing so that women can work as an agency, not rather than acting as a beneficiary. So thank you, ma'am. Thank you once again.
Thank you, Siddhik. Thank you,
Thank you.
Bushra. Thank you all.
So a formal vote of thanks is also there. So please.
Now, I welcome Siddharth R to deliver the vote of thanks.
Good evening, everybody. We are coming to the end of the second technical session and also the first day of the two-day international seminar on women and development. First, I'd like to thank Chair Dr. Bushra Begum RK, HOD, Department of Sociology, University of Kerala, for very effectively chairing the session. And next, I would like to thank Ma'am Bindu Varghese, member, Kerala State Planning Board, Government of Kerala, for presenting a very interesting session on the topic Women as Leaders of Response and Resilience, Kerala during COVID-19. The paper actually you have put in a lot of effort on the paper, which focused on the grassroots level women workers in Kerala, which is actually a shift from the international leaders who are actually already on the limelight. The focus on grassroots economics and the role of women in the grassroots level economics is very essential, especially in this scenario where there is gaining importance for women and development. Next, I would like to thank Dr. Siddiq Rabiat for organizing this session at the international seminar. Next, I would like to thank Dr. Anita V, HOD, Department of Economics, University of Kerala, and Dr. Christabel P, faculty and professor, Department of Economics. And I would also like to thank Sri Lakshmi Sudhakaran for presenting, for welcoming everybody to the session. And finally, I'd like to thank all the participants of the session for making the session interactive. Thank you. Thank you, Anjali.
Thank you, Siddharth.
Thank you, sir.
So we'll see you